This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to Candice Alcantara, Manager Corporate Communications at the Ministry of Health.
It's a pleasure to be here with you again at the Ministry of Health's virtual media conference, which provides an update on the COVID-19 response. Today, our expert panel will provide us with current information on the national response. We have the Honorable Terence Dayalsingh, Minister of Health, Dr. Roshan Parashram, Chief Medical Officer, who will provide the clinical update, and Dr. Miriam Richards, Principal Medical Officer Institutions. I am Candice Alcantara, Manager Corporate Communication at the Ministry of Health, and I will be the moderator today. The Honorable Terence Dayalsingh, Minister of Health, will open the proceedings this morning.
Thank you very much, Candice. Good morning to the Chief Medical Officer, Dr. Richards. Good morning to ladies and gentlemen of the media. I see some are decked off in their Sunday best. Very nice. Good morning to ladies and gentlemen of the viewing and listening public. Ladies and gentlemen, today is Wednesday, the 26th of August. The new measures which were instituted we are now into 9 days into those new measures. As you know, by now, the virus has a 14-day cycle, incubation cycle, and the new measures were in effect for 28 days, 2 cycles. So we are into day 9 of the first cycle. Now that we are firmly into community spread, we have to do several things. One, learn lessons, because this is a new pandemic, a new virus. Remember, Trinidad and Tobago and the world only has about 8 months experience in dealing with this new virus. And our actions today, how we behave today and what we do today, will help us flatten the curve in 14 days' time. What we did 14 days ago is what we are faced with now. I want to refer to, I think, one of the best written articles on COVID-19 so far. And it appears in today's Guardian, Wednesday, the 26th of August. And it's an interview with PAHO with Dr. Sylviane Aldigeri and also Dr. Carissa Etienne. What they are saying, and this is a non-political objective analysis of where we are in the Americas and the Caribbean. If I may quote, because I think what she has said is so vitally important, and I want to congratulate the Guardian and this particular reporter, Mr. Kevin Felmin. I hope I pronounced that name right. Responding to Guardian media's questions at yesterday's press briefing, PAHO Deputy Director Dr. Sylviane Aldigeri said TNT's problems are shared by many other countries in the Americas and the Caribbean. What we have been seeing over the past couple of weeks is that the demographic is changing. We are now seeing more and more younger persons being infected. And she goes on to say, based on PAHO data, the majority of reported cases are among people between the ages of 20 and 59. Despite this, almost 70% of deaths were people over 60 years of age. And we are seeing almost an identical epidemiological and demographic shift, as the CMO would have been explaining over the past 2 to 3 weeks. This indicates that younger people are primarily driving the spread of the disease. Many of the young people who contract the virus may not become or require an ICU bed, but they can spread it to others who will. She said this was a reminder that defeating COVID-19 was a shared responsibility. I think this sounds vaguely familiar to everybody who has been following our exhortations from these platforms. We have to learn lessons, new lessons, as we deal with this novel virus. It's going to be a long-term haul. It's going to be years. It's going to be years. And the world has to change. Our habits have to change. And our social expectations have to change from today. From today. The lessons learned from this second wave of this new virus will hopefully stand us at the Ministry of Health in good stead as we manage successive waves, because this is how the world is going to go from now on until you have a vaccine. We are going to be managing this thing in waves, ups and downs. But the lessons that we learned today at the Ministry of Health, hopefully, the third wave is going to be smaller, and the fourth wave is going to be even smaller. So it's a learning process. But again, we need the public's cooperation. As you know, mask legislation will be introduced into the Parliament tomorrow. It's a place that we thought that we should not have been, but we have to go there now because not everybody is getting the message about wearing masks. We will give you an update today on where we are with testing and clearing of the backlog. We are now down to about 600. In large measure, we have decreased it from 2 weeks to 1 week. There may still be some individuals, but by large measure, it is down from 2 weeks to 1 week. We are working assiduously night and day to clear this now decreasing backlog. Dr. Richards will give you an update into our increased capacity across the whole spectrum of care, from step down, quarantine, tertiary care, and so on. And the Chief Medical Officer, we signed off this morning, will explain in detail, I will just introduce it, that from today, we will now officially institute our next phase escalated response. What does this mean? It means that from today, we'll be asking certain categories of persons to self-isolate, whether it's at home or whether it's at elsewhere in a hotel or other setting. We are going to be strictly enforcing the quarantine orders, and I want to congratulate the TTPS for being so proactive in managing that case in Tobago. Again, it has to be the force of law now that is going to help us manage this. We are strengthening the capacity and have strengthened the capacity of the CMOHs now to enforce these quarantine orders. So this is where we are today. We have community spread. It was expected. Our numbers, as the CMO spoke about 2 weeks ago, have in fact gone up. It was expected. But we must now respond with very strong measures from the Ministry of Health. Before I close, I just want to clarify one statement that I may have made about 2 weeks ago about schools. I really looked at the Honorable Prime Minister's press conference, I believe on Saturday, the 15th of August, where he spoke about teaching institutions. Teaching institutions remain closed until further notice, depending on how this phase of the virus behaves and depends on how this phase manifests itself. I may have inadvertently said that schools will remain closed until January 1. So I may have misspoken there. But the Ministry of Health will provide the Ministry of Education and the Minister of Education and all their stakeholders with all the information and support so that the correct decisions could be made. So I just want to reiterate what the Honorable Prime Minister said. He said teaching institutions remain closed until further notice, depending on how this phase manifests itself and when this phase is over. So ladies and gentlemen, I want to recommend a couple of things that everyone should read this Guardian article today. It is spot on by a professional that where we are in Trinidad and Tobago. But having said that, we must take away some lessons from where we are in the second wave as we manage subsequent waves until either a vaccine is available or some sort of treatment. So, Ms. Alcantara, I want to thank you for the opportunity for the past couple of minutes. Thank you very much.
Thank you very much, Minister Dayal Singh. And we move now into the clinical update from Dr. Roshan Parasram.
Hi, good morning, Honorable Minister, Dr. Richards, Ms. Alcantara, members of the media, members of the viewing listening public. So I will give 3 bits of update, the clinical update as usual, followed by epidemiological trend, where we at, and then I will go into a bit of home quarantine and how we do home quarantine and home isolation. So with regards to the update, the number of samples submitted to the Caribbean Public Health Agency and other sites, 20,756. Number of unique patients done thus far, 17,834. Number of repeated samples, 2,922. The number of private sector tests done thus far, 5,611, giving us a total public and private sector, 26,367. Number of samples tested positive, 1,384. Number of active samples, persons, 1,177. Number of deaths remain at 115, which represents 1.08% of the total positives, confirmed positives that we have. Number of persons discharged are now 192. Dr. Richards will go into detail with regards to the parallel system, so I won't give that piece of the clinical update this morning. I wanted to go straight into the first graph, which shows you the epidemiological update up to the 22nd of August. If I could have the first graph, please. Yep, so a couple days ago, we would have submitted a similar graph. The blue parts of the bar chart represents basically July. The purple parts represent August. So as we know, the epidemic, the second phase would have started on July 20th, 2020, where we would have had the introduction of the reintroduction of the virus into the population via an induced case. And just for clarity, an induced case means that you would have had a person who was in contact with another individual who would have recently come across the borders. So that started on July 20th. In the first, as we follow the graph from left to right, we see the blue ends July 30th, 31st. Then we go to August in the purple. We would have had a series of events that occurred in the first week of August, thereabouts, that we would have had a number of mass gatherings, persons not adhering to the public health guidelines, and thereafter, the subsequent bars continued to rise after those days. So we have a peak of about 62 occurring, I believe, into about 10 to 14 days after the 1st of August. So about the 14th of August, we would have had a peak going up to 62. The graph is accurate in terms of numbers up to about the 18th. So we actually see a natural decrease coming down thereafter. If you follow the dotted line going across, there's an upsurge peaking at about the middle of August and then starting to go back down. We won't know what will happen over the next week until we get those samples completed, and then of course the graph will continue to go onwards as we go forward. What will happen in the coming week, next week or two, is determined by our activities and our actions over the next couple of weeks or so. What has happened in the first week of August is already determined. It is as a result of past behaviors. What will be coming to us in the future is determined by our behavior over the next week or two, and our epidemic can change significantly, going either continuing to rise upwards, or we can slowly spread and flatten the curve if persons adhere to all the public health guidelines. So we see generally trends that, based on our behavior as a general in the population, occurring a week to 2 weeks after our behavior is occurring. So we expect to see a decline if our measures, as Minister would have indicated, our measures were put in place on the 9th, just about 9 days ago. So we expect that we would start to see a decrease in the rate of increase, hopefully within the next few days. If that does not happen, then it means that our behavior hasn't changed significantly, and therefore we continue to see a rise. So we hope that over the next coming few days, we can begin to see a decline in the daily numbers that are on our charts. In terms of the next slide. So before I go into the graph, so there's two policy decisions that were taken in terms of the two criteria. So the admission and discharge criteria has changed in the country. I will just go through a bit of the how to self-quarantine in detail. So if you look at the chart, it says stay in your home or accommodation. Do not go to work, school, or other public areas. Do not have visitors in your home or accommodation. Wash your hands before and after contact with your pets. Use separate facilities if sharing. These should be cleaned before and after use by others. Separate yourself from others in your home or accommodation. Wear a mask when you are around others, even in your home. And this pertains to people that have flu-like symptoms or are diagnosed as COVID positive and have food, medication, and other supplies delivered to you if appropriately. So these two documents that we have are available on our website at the Ministry of Health. So basically, we have taken two decisions as it relates to admission and discharge. So the discharge from our step-down facilities, as you would have noted about a week ago, we took a decision to go down to one negative swab upon discharge. That has been further updated. So we're going to clinical criteria for discharge, which is recommended by WHO. So there's no diagnostic criteria. So you won't be getting a negative swab upon discharge. What we are doing is we are going to two categories. So the first category for symptomatic persons, if you spend 10 days from the date of onset of your symptoms, 3 days plus 3 days with no symptoms at all, we will discharge you to your home, giving you a quarantine order to stay for further 7 days at your home without a diagnostic test being done, and you can be assured after that period that you won't be able to transmit the virus to anyone else. So persons who are in step-down facilities, we will be able to discharge you quicker, and that should happen between today and tomorrow. And you'll be asked to quarantine for a further 7 days at home. And after your 7-day quarantine is finished, you can continue to go about your daily activities after that 7-day period. In terms of asymptomatic persons who had no symptoms at all, those persons will now be asked. The criteria is very similar, but your 10-day period will start at the point that you had a positive test, rather than at the point that you began to have symptoms. So 10 days plus the 7 days at home for those individuals that had no symptoms throughout the process. By way of our admission criteria to hospital, we are trying to ensure that the bed space in hospital are reserved for moderately and severely ill people. So what is going to happen is that the CMOH offices will have a list of all the positive persons in the country. They will call those individuals twice a day, do interviews, clinical interviews to determine what are your signs and symptoms like, if it has worsened, if it is better, if it has stayed the same. They will also ask you about your household, if the persons in your household have any signs of symptoms of disease. If they do, we can send someone out and have those persons swabbed to see if they're positive or negative as well. But we're asking everyone to stay at home for the full duration as I described before, once you are COVID positive. So you'll be doing similar to the hospital discharge. So 10 days from the onset of symptoms, plus 3 days without symptoms, plus 7 days. So on average about 20 days to ensure that when you go back out, you are not infective and you can't infect anyone else. So that is our admission criteria. In terms of persons from high-risk groups, persons who are moderately or severely ill, experiencing difficulty in breathing, vomiting, extreme lethargy, very tired, those persons will be picked up by the CMOH. We will call the ambulance service and get you either to Cora or Cuva in the first instance. If, of course, in between those calls, persons have worsening symptoms, you can take yourself either to any of the emergency departments or call the GMRTT ambulance service on your own. The hotlines are also available, 877-WELL, 800-WELL, to call at any point in time as well, so that you can get information between those calls from the CMOH. Candice, that's my clinical update for this morning.
Thank you very much, CMO. And just to advise the public that information is also available on our social media platforms, how to self-quarantine and measures that you can take at home. And we move now to Dr. Richards, who will provide an update on the status of the facilities in our parallel healthcare system.
Good morning, Honorable Minister Terence Dayal Singh, Chief Medical Officer Dr. Roshan Parasram, Manager Corporate Communications Candice Alcantara, members of the media and members of the listening and viewing public. This morning I shall provide an update on the parallel healthcare system, which is the Ministry of Health's response to the COVID-19 pandemic. The parallel healthcare system at this time consists of 16 facilities spread across 4 levels of care. The parallel healthcare system disaggregates patients as COVID positive, those that are suspected of having COVID, and persons of unknown status with respect to COVID-19, that is, persons who would undergo quarantine, such as returning nationals. At present, the Cora Hospital and the Couva Medical and Multi-Training Facility are used to treat patients who are COVID positive and who are ill. At the Cora Hospital this morning, we have 63 patients, while at the Couva Hospital, we have 108 patients. Of those 108 persons, 94 are at ward level or ambulatory level, while 9 are in the high dependency unit and 5 are in the ICU unit. This gives a total of 171 persons. We also have a category of patients, that those who are COVID positive but who are asymptomatic and just awaiting their discharge home. This category consists of 7 facilities: the UWI Debe Penal Campus, the UWI Canada Hall Campus, UWI Freedom Hall, the Balandra and Brooklyn Centers, Tacarigua and Napa for healthcare workers. At the UWI Debe Penal Campus, we have 53 persons. At the UWI Canada Hall Campus, we have 133 patients, while at the Freedom Hall, we have 66 patients. At Balandra this morning, we have 37 patients. At the Brooklyn Center, we have 31 patients. At Tagarigua, we have 40 persons. And at Napa, we have 14 patients. This gives a total of 374 patients. Our next category of patients are those who are suspected of being unwell and who we are awaiting a COVID-19 test on. This category entails the Arima General Hospital and the Augustus Long Hospital. At the Arima General Hospital this morning, we have 41 patients, of which 40 are ward level or ambulatory, and 1 patient requires HDU care. At the Augustus Long Hospital, we have 7 patients, of which 2 are categorized as high dependency. That gives a total of 48 patients who are in the category of suspected ill COVID patients. The last category that the parallel healthcare system looks at is the quarantine facilities. These quarantine facilities can be divided into state facilities or state-supervised facilities. The state-supervised facilities consist of hotels. These hotels are the Chancellor Hotel, the Cascadia Hotel, the Regent Star Hotel, and the Paria Hotel. As of this morning, we have 28 persons at the Chancellor Hotel, 41 at the Cascadia Hotel, 51 at the Regent Star Hotel, and no persons at present at the Paria Hotel. The state-supervised facility that is currently being used as a quarantine center is the Home of Football, which currently has 5 persons. It is important to note that an important feature of the parallel healthcare system is the interoperability of the system. That is, we look at the critical rate-limiting steps and factors depending on the progress of the pandemic. At present, we require more spaces in step-down and transition facilities, as well as the hospital spaces. It is important to note that once a patient is well, they are transferred or stepped down into a transition facility. Accordingly, we have been able to transform and transfer our state quarantine facilities to step-down facilities. As such, the Home of Football today, once the 5 remaining persons are discharged, will be converted into a step-down facility. We have seen that measure already being exercised at the UWI St. Augustine Debe Penal Campus. We have also recognized the need for an increased number of beds, and within the next 3 to 5 days, we anticipate that we will have an additional 264 beds available for persons who require step-down or transition care. At the UTT Val-St. Teachers Campus, we anticipate to have 120 beds available within the next 48 to 72 hours. At the UWI St. Augustine Debe Penal Campus, we anticipate to have 80 beds available within the next 3 to 4 days, while at the St. James Medical Complex, we anticipate to have 64 beds ready within the next 48 hours. This gives a total of 264 additional beds, which complements the existing 1,171 beds that are available in the parallel healthcare system. At this point in time, we have been able to manage the step-down and transition patients, but as the Chief Medical Officer advised, a new protocol for the discharge of patients will be instituted as part of the Ministry of Health's escalation plan. We anticipate that with the institution of this guideline from today onwards, there would be a discharge of possibly over 400 persons to undergo a further 7 days of quarantine. Thank you very much to all. I'll now pass back to Candice.
Thank you, Dr. Richards. Next on the agenda is the question and answer segment. We remind our media representatives, please state your name and the media house that you represent. In the interest of time, we ask for 2 brief questions per media house in the first instance, and we will try to facilitate more questions in the end. We begin with CNC3.
Hi, good morning, everyone. Rashad Khan here, Guardian Media Limited. Okay, so my first question is either to Minister Dayal Singh or CMO. Now, we understand that yesterday, 3 Venezuelan nationals would have escaped from Canada Hall. So I just want to get some clarification on what their situation would have been. Were they positive patients waiting step down, or were they just simply being quarantined there? And my second question is to Minister Dayal Singh or the CMO again. Why now? Why have we chosen now to begin the home quarantining? And I would like to note, Minister Dayal Singh, that on Monday I asked you what is our next plan, our next step in our plan going forward, and I simply got that we are considering many different options. So is it that between Monday and today that we decided that we are going to start doing the home quarantining? Thank you.
Yes, so you are quite right. On Monday when you asked, I said different options are under consideration. And we have considered it between Monday and this morning. And this is the option that we have come up with. It was always part of our escalation plan. What we have simply done is now officially introduced it into the public domain. Okay? Thank you very much.
Yeah, in terms of the Venezuelan nationals, I was informed yesterday afternoon that 3 nationals who were actually at the Canada Hall, which is a step-down facility, those persons have been asymptomatic for quite a long period of time. They were awaiting their final discharge, which would have been in the next couple of days. So I was informed that they were able to escape from that facility or leave that facility. The Trinidad and Tobago Police Service was informed from the CMOH office and I believe North Central Regional Health Authority as well. So that process is ongoing in terms of, from the police side of it, at least dealing with those individuals, but their infectivity would be extremely low to none at this point in time, based on the length of time they would have been asymptomatic and in those facilities.
Thank you very much, CMO. And now we go to Guardian newspaper.
Hi, good day. Charlene Rampasad here from Guardian newspaper. We have been getting some complaints from the COVID district health facility that staff there are being made to transport COVID swabs in ambulance along with members of the public who are going to other facilities. We've been told that transportation is being done without the necessary biohazard packaging. Can the minister comment on that?
So I have no information. The CMO has no information on that, but we will look into it under the auspices of the CEO of Southwest RHA, under whose responsibility that facility falls. But thank you for raising the issue, Charlene.
Thank you very much. And now we go to TTT.
She has another question.
She has another question.
Oh,
Charlene,
sorry.
you have a second
you have
question?
A second question?
Yeah, sure. Go ahead. Sorry.
Oh, yeah, let's raise her mic.
Right.
So
given the high number of complaints that we have gotten as well from the Camp Valandro facility in terms of the people are complaining that the facilities are not adequate for the quarantine. Can the ministry state what are the criteria for selecting these facilities?
So we have been through that many times in the past. Those facilities have been used over and over without much complaint. We understand that quarantining is difficult for people, and issues are going to be magnified and highlighted. We do understand, and we will try to make the group as comfortable as possible. But as you could really imagine, Charlene, it is difficult in these circumstances to manage individuals and make sure every individual gets exactly what they need. It is not home, we admit that. But again, the CEO of Eastern RHA, who is responsible for the facility, is well aware of the issues and will endeavor to make the stay as comfortable as humanly possible under these difficult circumstances. But again, thank you for raising the issue.
Thank you, Minister. And now we go to TTT. Sorry, could you repeat, please? I think we missed the beginning of your question. We need to probably raise the levels so that we can hear from the beginning. Thank you.
Okay, good morning. Ian Wilson again from TTT News.
Morning, Ian.
My question has to do with the new criteria for admission and discharge, because it seems that they are relaxed as they were before, because we took pride in our strict criteria before. Now, we have a difficulty in getting the general public to comply. And for this criteria to work, we need compliance from the general public. Now, how confident are you in that this will work? Because we still want to see a decline in our daily numbers. So how confident are you that these criteria will work to flatten the curve?
Yeah, so the criteria is a WHO criteria that has been recommended for countries with community spread. All right, so we are aligned to what WHO has been advising for quite some time. As you rightly said, our criteria for hospital isolation versus home isolation was very strict, and necessarily so. Once you have a sterile, if you want to call it a sterile environment in the country, and as you would have noted, there was an 80-day period where we had no new infections. And we had to maintain the robust nature of our quarantine, both in admission and discharge, in order to keep it at that place. But with community spread, of course, as you know, the environment, there's viral persons spread throughout the country, as we had shown the GIS graph late last week. So the spread is throughout the country at this point. It is community spread. So, of course, there will be changing policies and procedures based on the level of spread. What, of course, obvious limitation that you raised to us with regards to home quarantine, as we have always had. We saw a number of people breaching the quarantine orders in the past. And there's an inherent risk for persons being asked, now that they are positive, to stay at home and not leave their homes, because that places a particular degree of personal responsibility now back on the population, that we expect an increased adherence to our quarantine orders to ensure that this virus is maintained and doesn't spread beyond a particular household. And with the guidelines that we discussed before, we are trying to get persons, even within your household, if you have COVID-19, you have a viral illness, that you wear your mask even within the house, and you protect the rest of your household from getting infected. So that even becomes a little more acute in terms of the personal responsibility that has to occur. And of course, there are situations where persons have multiple individuals living in one particular small dwelling, that it is extremely difficult to prevent spread from one individual to the next. But it can be done by wearing masks and adhering to the guidelines that we put in place and that are available on the website. And we'll be going a little deeper into our communication strategy to try to get the information out there to everyone, so that persons know basically how to isolate properly at home to prevent the spread even in a household. But of course, given the public health ordinance and the quarantine orders that are being given to you, those are enforceable under the law, and if persons breach that, we will have no choice but through the TTPS to enforce those laws to ensure compliance.
As we have done in the case in Tobago. Let me just add that.
Hey, thank you very much, Minister and CMO. Do we have another question from TTT? Okay, so we move to AZP News, please.
Good morning to all on the panel. Pamela Ram.
Morning.
I have two questions this morning. And the first, of course, Dr. Paris Ram spoke about the 3 Venezuelans that would have fled from the whole facility. Was there a lapse in security because these facilities manned by either police officers or security guards? And with right now, some of them are about the regulations and those with 4-seater vehicles. What they have been told is that however, so I'm
so sorry, we seem
to also doing the same. You have the driver.
Ms. Ramcharan, I'm so sorry. We seem to be missing a part of your question. I think we got the first question. So if you can repeat your second question to the point, so we'll get the connectivity and make sure that we answer for you.
Are you hearing me?
Yeah. Lovely. Yes.
All right. So my second question relates to taxi drivers, particularly those 4-seater vehicles. Now, according to the regulations, they are to carry 50%, so 2 passengers. My question would consider driving because when they have 2 passengers, they either have 2 sitting back or they have 1 front and 1 to the back.
Okay.
Okay, thank you. I think we've gotten the gist of your questions. Thank you very much.
Right. So to take your second question first. So the taxis, they are licensed, I believe, for 5 persons, including the driver. So if you do 50% of the other 4, that's 2 passengers at any one given time. With regards to the Venezuelan nationals, all our facilities are manned by the Ministry of National Security through the Defense Force. So all our quarantine facilities as well as our step-down facilities are manned by those individuals.
Thank you very much. And we move to I-95.5. I-95.5, are you online?
Hi, good morning to everyone. Whitfield Journal from I-95.5. I just want to have it confirmed. We were seeing reports where the Camp Signal Hill would have been basically shut down because of a someone there possibly testing positive for the virus. Can you confirm that for me, and also what impact that is likely to have, if it's in fact true, on the operations in Tobago in terms of the security arrangements for persons who are at the various facilities and so forth?
Okay, thank you. We will try to find out from the authorities in Tobago, but in the interim, if you can't get an answer from here, I could suggest you contact the Secretary of Health and Wellness in Tobago, but we will try to find out from the CMOH in Tobago, Dr. Tiffany Hoyt, because I think your question is valid, but it is really for the authorities in Tobago to reply. But we will try to get an answer. Candice, before you go, I did promise on Monday, because a member of the media did ask about live streaming of services, and I did promise to get a legal opinion or interpretation of the regulations, and I'm happy to report that the regulations allow for live streaming as long as it does not exceed 10 persons and that the organization complies with the guidelines for places of worship. So, promise made on Monday, and I'm happy to give that clarification.
Thank you very much, Minister. And we move now to Channel 5 in Tobago.
Hi, good morning. I'm Candice Jackson from Tobago Channel 5.
Good morning.
My question is in regards to an issue I brought up on Monday regarding the fisherman that was charged for bailing out some water out of his vessel. Fishermen in Tobago are right now actually very scared about going out because they're not too sure where the law stands in regards to their activities. So I was just wondering if you guys can give us some clarity as to where fishermen fall under the law, under the public health ordinances and so on.
Okay, we will check on that for you and I'll get back to you. So I'm taking a note of it how do fishermen fall under this, right? If we don't get an answer for you before the end of this broadcast, we could certainly see about it. Thank you for raising the issue.
Thank you very much. And now we move to TV6.
Hi, good morning. Alicia Boucher from TV6 News. My first question, given that persons who, are COVID positive, but they have mild cases are now going to be allowed to self-quarantine, and that COVID-19 for some persons that it is spread to can be a possible death sentence. Do we have any plans on increasing the penalties under which a person breaches that quarantine order? That's the first question. The second question is, can we get an accurate picture in terms of the number of daily tests that are done, especially those at private labs? If you can just kind of give us a breakdown as to how many tests are done in their various aspects daily, as well as those coming in from private labs. Thank you.
Before we go to the CMO to answer, I'm looking through the regulations to try to give some clarity to the issue of fishing. Where I am seeing in the regulations 3D, the only reference I'm seeing to boats is the operation of a party boat, right? So I'm not seeing anything that prohibits fishing, especially fishing as a business, but we will clarify it. Okay, thank you.
Yeah. So you have two questions in terms of the quarantine fee, I believe. I think that change occurred a couple years ago about in terms of the Quarantine Act.
Yeah.
The fine had gone up to $6,000. It was $480, I believe. So anything can be given consideration. So we will consider a possible increase, but I think we really need the population to exhibit personal responsibility and ensure that you all stay at home. It is not something that we want to enforce in any way, form or fashion, but really it is for the betterment of the entire population that we stay at home when we are told to quarantine. But we can relook the fines, but I think the fines are sufficient at this point in time. With regards to your question on the numbers from the private sector, so far private sector did 5,611 over, I believe, the period 7th of August to the 25th of August. So that's how much samples we would have sent to them, and they would have turned around for us, including persons that would have gone in to the private sector separately. So that gives you an idea of how much private sector work is going on at this point.
Thank you, CMO. And now Express.
Hi, good morning. Camille Hunt, Express newspaper. Minister Dial Singh, yesterday you said the backlog of samples had been reduced by about a week, and I had asked how many samples are still in the queue to be tested to eliminate that backlog. Are you able to provide that information now?
Yeah. Sorry. Go ahead. Sorry.
Following up on Ian's question, under the new criteria for discharge, where people will be allowed to quarantine at home, firstly, how many people are in home quarantine at this time? And Dr. Parasram spoke about monitoring to ensure that people do in fact stay at home. What exactly does this monitoring entail? Will we perhaps see police or some sort of security implemented to physically monitor these people? I don't know how feasible that is, but are we just relying on people's honesty and their sense of responsibility? How will they be effectively monitored?
Thank you very much for the questions, Camille. At the start, I did indicate that we are looking at a backlog right now of about 600 tests to turnover. So that is the figure that we are looking at. The Chief Medical Officer will go into details about the quarantine, but let me remind, we have been asking people to self-quarantine from very early. If you would recall, before the borders were closed, 19,800 people roughly came into the country, and we had asked them to self-quarantine, and we were expecting a massive spike back then. We did not get it because I think most, if not all at that time, adhere to the self-quarantine measure. So we do have some experience with it. We have, over the course of this pandemic, relying on the TTPS to assist us. That has been ongoing, but the CMO will give you some more details on how the self-quarantine will continue to work as it has worked in the past.
Right. So just to give you an idea, so we would have had people. There's different categories. So there's persons that would have been said to self-quarantine, those that would have been exposed. So we have primary contacts, we have secondary contacts for a 14-day period at their home. So that was ongoing throughout the epidemic. What we have added today is that persons who are actually positive for COVID-19 are now being asked to stay at home and isolate for a certain period of time based on the letters that you'll be getting from the CMOH offices. The difference is, of course, that you are known positive as opposed to having an exposure and you actually have flu-like symptoms. So the monitoring is to do two things: to ensure that you stay at home, one, which will be in conjunction with the TTPS. So everyone that is positive through the CMOH offices, that list of names will be sent to the TTPS so that they can actively monitor from their end in terms of breaches of your quarantine, as well as a clinical monitoring twice a day by the CMOH office to ensure that persons don't de-escalate in terms of symptomatology. And that is the more critical part of it, because as we know, with persons at home with this particular virus, we have to monitor often to ensure that persons don't have increased difficulty in breathing, vomiting. Those are some signs: increased lethargy, unable to eat. So if you have any of those symptoms, of course, let the CMOH office know. But you can also call your nearest healthcare provider in between those calls that should be occurring twice daily. But it's extremely important that you monitor yourself and your family at home as well to ensure that no one else gets symptoms. If someone else in the household gets symptoms, they can be swabbed as well, even at home. And then, of course, we will let you know if that person is positive or not. If that person, again, is low acuity in terms of clinical signs, meaning very mild symptoms, they can continue to isolate with the family, and only if symptoms get worse, then we will take you into a hospital setting if need be. So in terms of just to give you a little snapshot of the numbers, so I had gotten from the Southwest Regional Health Authority a little snapshot today. They actually did a very good summary of what they were doing in the community. So if I could use the number of COVID-19 cases, this was before, as of the 24th, so a couple days old. Victoria County 139, St. Patrick 32, Caroni 70, giving them a total of 241 COVID positive cases. They have the number of new cases, the number of epidemiologically linked cases they also have on this form, which gives a certain percentage for each category. So when we look at the percentages, we see for cases that were epidemiologically linked in Victoria, we have 46%, St. Patrick 46% as well, Caroni 58%. So we're roughly hovering around 50% of the cases that we're finding in the Southwest region are actually epidemiologically linked to each other, which is a good thing in terms of the epidemic. It means that the unknown hidden cases are popping up, but we still have 50% linkages from one case to the next. In terms of symptomatic persons, we have roughly about 65 to 70% of persons who are positive presenting with some significant degree of symptomatology. Again, the number of cases who are primary contact are somewhere varying between the counties, 41% and 55%. So we have a lot of primary contacts becoming positives, and we assume those are the household contacts. So it's very important for us to learn how to prevent members of our own household from getting infected, and that's why the home care guidelines are especially important now. And of course, to prevent other individuals who may be primary contacts, and we're dissuading people from coming into your homes if you're COVID positive, of course, and following the other parts of the guidelines. So that will be available on the website, and at later press conferences we'll go a little more into detail for every category to try to go answer your questions related to how we should home quarantine. But it really relies a lot now on the personal responsibility as well as the quarantine orders together with the TTPS to ensure people stay at home. Candice?
Thank you, CMO. And now questions from Newsday, please.
Hi, morning. In charge of Newsday here. My question, firstly, I want to get an update on a 10-month-old who was apparently admitted to Cuba for COVID-19. If we can update us to the status of that particular patient, and also can we also get an idea as to why doctors at the accident, internal medicine, and emergency departments at Mount are apparently still waiting for COVID-19 test results. Apparently, these results they've been waiting for the last 13 days, according to the information received. So, can we get answers on those two particular questions, please?
Well, as we said before, we really don't want to go into details about a particular patient. So I would prefer not to comment on a particular patient at this level. Of course, we will communicate with the relatives, and the clinicians have been doing so in all cases. But I don't want to give out details of a specific patient's clinical status at this time. With regards to the, just to clarify, your A&E, you said A&E internal medicine. Is it that I'm getting the impression that physicians are waiting for results?
A&E internal medicine. Yeah.
It's two different departments. So is it that physicians from those units are waiting for tests, or they're waiting for tests from patients?
I think they were waiting tests, is what we're told.
For the doctors themselves?
Yes, that's what we were told.
Okay, well, I will try to get in touch with the CEO of North Central Regional Health Authority to get further clarification on that particular issue. North Central, as they would have put out in a press release, now they have a lab that is actually doing COVID-19 testing in-house. So there should be no reason why someone should be waiting that length of time for a test from North Central. But I'll get clarification from the CEO.
Thank you, CMO. And now we will take questions from CL Communications, please. Are we getting CL Communications online?
Hi, good morning. Vern Extable from 91.
Morning, Vern.
Hi, morning. Just two quick things. CMO, with the introduction of this new policy to take persons that are positive and not seeing symptoms and keeping them at home, it again begs the question that people are to take personal responsibility. And while I know many people could access the ministry's website to see it, is there any advice you could give to people who are not positive, moving around their daily lives, may have to go to work, in terms of when they get home? A lot of people are talking about sanitizing under your shoe, taking off your clothing, that kind of thing. I think some of those messages have gotten lost since we began, so it might be good to just recount those to give advice to people in terms of how to practice some personal safety, when they get in and out. Minister Dialsing, just to clarify, the beaches situation was raised because the fisherman was held because he was at the beach, not because he was plying the fishing trade. And as you know, he was emptying the boat of water, and they didn't believe him and say, well, the beach is closed, so you're not supposed to be there. Correct. And he was arrested. And that's just just to add to what Candace sort of gave.
Thank you very much.
Okay, so in terms of, it's a very good comment, Vern. Protecting your household from COVID-19, this particular document that is on the ministry's website, I'll just go through. So it does have a section that says Section 2, stay safe when you're entering your home. And it goes through when you return home, try not to touch anything or anyone where possible. Leave bags, wallets, keys, etc. in a box at the entrance along with other packages. Take off your shoes and sanitize. Remove your mask carefully behind your ears. Try not to touch your eyes, nose, and ears especially. Wash your hands. Wipe your mobile phone and glasses. Sanitize other surfaces that you would touch, doorknobs, etc. Clean the surfaces of all items brought in from the household, example, groceries. Take off your clothes and keep separate from other clothes that were not worn outside. Take a bath if possible. Remember, it is not possible to do all things and to sanitize all objects, but we're trying to reduce the general risk of bringing COVID-19 into your household and any other space that you may occupy by fomites. So this document on the website should allude to some of it, and we will be going out with some campaigns with this document in the near future.
Vern, I really want to thank you for raising that issue. These guidelines were already printed in the newspapers some time ago, but we are going to reprint it because we don't, I mean, even I wouldn't remember what I saw 2 months ago, but you have raised a very good question. They were already in the public domain, but we will make sure and repeat it across mainstream media, social media. We are even doing an app now so it will go directly into your phones. So thank you, Vern.
Thank you very much, Minister and CMO. And just reminding everyone again, there's a Ministry of Health app, and this information is also available on the app. It's Ministry of Health Trinidad and Tobago, available on Android phones. And we're moving now, are we moving to Guardian Media for one follow-up question? Or is it Guardian newspaper? Okay, I think we may have some technical difficulties. And so at this point, we seem to have reached the end of this morning's press conference. Thank you everyone for all the information and all of the participation. I know that Minister Dayal Singh just wanted to raise some matters as we close. So I hand the mic over to Minister Dayal Singh for his closing statement.
Thank you very much, Candice. I just want to bring the country up to date on where we are with vaccines for COVID-19. You may recall about a month or month and a half ago, I did say that Trinidad and Tobago, by letter signed off by the Honorable Prime Minister, spoke about access to vaccines. The update is from the 24th of August, PAHO's joint regional consultation with Gavi on the COVAX facility is in force. We have signed on to it. What COVAX will do is invest in a portfolio of active vaccine developments and candidates that look good to ensure that we find a successful vaccine. The objective of this is to deliver over 2 billion vaccines by December 2021 to end the acute phase. Notice the word, the acute phase. We are in the acute phase, and guarantee access to all participating countries. So Trinidad and Tobago continues to pursue its road to having access to safe and effective vaccines, and we have signed on to this not only by the Honorable Prime Minister, but now at the Ministry of Health. Thank you very much for bringing the population up to date on vaccine development.
Thank you very much, Minister Dayal Singh, Chief Medical Officer, and Dr. Richards. Before we go, a special thank you to all of you who serve your fellow countrymen every day by following the new normal guidelines. Do have a good, safe day.